Hi there. I want to first acknowledge that this project was funded by USDA Supplemental Nutrition Assistance Program. Next slide, please. My name is Holly Seitz, and I'm an associate professor of communication at Mississippi State University. I'd also like to recognize my co-authors, Laura Downey, Sylvia Bird, and Drew Cole. And today I'll be talking about Happy Healthy, which is a multimedia social marketing campaign in Mississippi that's designed to increase fruit and vegetable consumption among Mississippians who receive supplemental nutrition assistance. And in particular, I'm going to be reporting on the results of an evaluation that was conducted in 2020. And the 2 time points allowed us to examine the impact of the campaign and the impact of the COVID-19 pandemic on self-reported fruit and vegetable consumption and physical activity. Next slide, please. First, I want to provide a little bit of background about the campaign itself. Happy Healthy is a multifaceted social media, social marketing campaign with mass media elements, web and social media elements, print material, and in-person events. Next slide, please. You'll see here some images from our website, which showcases the recipes that are created for our audiences. Next slide. You'll also see some social media posts. Social media is a key component of our social marketing campaign and a key way that we share recipes with our audiences. And the next slide. Oh, one back. Thank you. And then finally, you see here some of our in-person outreach activities. In particular, this is one of our visits to a school to do food tastings. And these in-person education events are another key component. And next slide. Although the initial campaign itself launched back in 2018, we were preparing in 2020 to launch a revamped mass media component of the campaign. And so we decided to collect some data that would provide a baseline to allow us to measure the effects of that campaign relaunch planned for 2020. The data collection effort was actually already underway in March of 2020. That's when it had been planned to begin, when the World Health Organization declared COVID-19 a pandemic. And so we continued that data collection in March and April of 2020. We relaunched the mass media campaign over that summer, and then we collected another time point of data in September and October of 2020. Next slide. This evaluation data collection was a panel design. So we used an online survey at 2 time points, and participants were recruited from throughout Mississippi. They were all SNAP eligible individuals in Mississippi who met an income threshold that we set, and they all had children under the age of 18 in the household. And then we conducted descriptive statistics, some paired sample proportion test, paired sample t-test, and one-way ANOVA to examine the effects of the campaign on changes in behavior. Next slide, please. We found that campaign awareness between the 2 time points increased dramatically and significantly. So from time 1 to time 2, we saw a change in awareness of the Happy Healthy campaign go from 16% to 67%. So again, quite substantial. What we found though was that there were no significant changes in fruit and vegetable consumption, and there were also no significant changes in physical activity during that time period. So at that point, we decided that we would examine the elephant in the room, which was the COVID-19 pandemic that was so active during that time point. And as we knew from personal experience, had dramatically changed people's physical activity patterns and also had changed nutrition because of changes in access to food during that time. So next slide. At that point, we asked in the time 2 survey, we actually at the last minute added a question to inquire whether the COVID-19 pandemic was affecting their fruit and vegetable consumption or their physical activity or both. In that time 2 survey, 23% of participants, so about a quarter, reported that they were actually eating fewer fruits and vegetables during the COVID-19 pandemic or due to the COVID-19 pandemic. And then 34% reported that they were being less physically active than normal due to the COVID-19 pandemic. So we saw here that this pandemic was affecting physical activity patterns as well as nutrition. And what we think is that that's part of the reason why we were not seeing those effects of the campaign. Certainly, any campaign is not expected to have dramatic effects on physical activity and nutrition, but we were hoping for some reported effects. So if you'll go to the next slide, I can summarize here that what we're seeing is the impact of the COVID-19 pandemic on nutrition and physical activity, and this may have sort of dampened any effects of the campaign that we would have seen during that time. So because of that, we decided that data collection at a third time point is necessary to see if we are starting to see any changes back in the positive for increased physical activity and increases in fruit and vegetable consumption as the COVID pandemic changes. And hopefully as people are starting to maybe increase their physical activity, have better access to foods, and get back to those pre-pandemic activities and routines. So we are planning a future evaluation, and we also wanted to share this information because it may be useful for anyone else who implemented some campaigns or activities during that time and may not have seen your expected effects. We think that part of that lack of effects may be due to the pandemic itself. Thank you so much. I appreciate the opportunity to be here today, and I encourage anyone to get in contact with me or to follow Happy Healthy on social media. Thank you.
Hello, everyone. Welcome to our Speed Talk, Planting Seeds of Success, Lessons Learned in SnapEd Social Marketing. My name is Eli Steiger-Ginsburg. I am the Communication Manager for the PA Nutrition Education Network, also known as PANEN.
And my name is Alex Battaglia, and I'm a project manager in the Research and Evaluation Group, and we both work at Public Health Management Corporation, which is based in Philadelphia.
And we're here today to share a little bit about our experience administering and evaluating a social marketing campaign focused on nutrition and physical activity promotion. Next slide, please. So say hello to Be Healthy PA. This is, as I mentioned, a nutrition and physical activity promotion campaign funded with SnapEd dollars. It's been active for about 3 years, and our target audience is comprised of SNAP recipients and SnapEd eligible Pennsylvanians. So our total audience encompasses approximately 3.5 million people across all 67 counties, and where we target is based on census tract data. We primarily deliver paid ads digitally to this audience through the Meta, Facebook and Instagram platforms. And the goal of our ads is to drive people to our website, behealthypa.org, where they can use one of a few different health-related resources there, things like healthy recipes, pathways to SNAP benefits, SnapEd programming in their zip code, free physical activity opportunities like state parks. And ultimately, these are resources that support SnapEd's goals to promote education about healthy behaviors, such as increased fruit and vegetable consumption, increasing physical activity, and all towards a broader goal of preventing obesity and other health-related conditions that are, derived from healthy lifestyle choices. Next slide, please.
Okay. And we disseminated a survey. Oh, sorry, could you go back one slide? We disseminated a survey in January 2022 after a couple of weeks of running ads on Facebook that Eli had run. And to evaluate the Be Healthy PA campaign, our survey aimed to answer 4 main evaluation questions listed here, which are based on the SnapEd evaluation framework, which assess participant rate of aided recall, intention to change behaviors, actual behavior changes, and knowledge of food assistance resources. And our main goal here was to compare the responses we received of those who recalled the campaign versus those who did not. So to do this, we disseminated a retrospective panel survey to see if the campaign achieved the intended outcomes, while Eli used this opportunity to assess the messaging and the creative elements. And so for methods, we used the survey platform Alkimar to deliver a panel survey to our target audience. So to do this, we oversampled certain counties in Pennsylvania and used screener questions to ensure a representative sample of SNAP Ed eligible participants. Next slide, please. And so, sorry, next slide, yeah. And so what did we find? First, I should mention that we measured outcomes using correlation, not causality, but we did find preliminary evidence of campaign success. So we found that people who recalled the campaign were more likely to report behaviors aligned with campaign goals, such as healthy eating, physical activity, and by some measures, food resource management. Next slide, please. And finally, we looked at recall rates. About 1/3 of survey respondents said that they recalled the campaign or its logos, while 2/3 did not, which is on par with other SNAP Ed campaigns that we have looked at.
And so over the same period as the panel survey was administered, we did see a lower recall rate estimated through Meta's ad platform, and that was about 10%. And we attribute this discrepancy to a couple factors. The first being that we didn't necessarily give enough time between or allow enough time for the ads to run for Facebook to refine its delivery approach. And so for that reason, we don't expect these numbers to match. And furthermore, the panel survey was measuring recall for the whole lifespan of the campaign. And it's like, do you recall any of these ads or this logo? So whereas the Facebook estimated recall rate is based on that specific ad running over that specific period. So we do expect that number to be quite lower. Next slide, please. But we were able to improve the estimated recall rate on Facebook's platform in the preceding months of the campaign through a process of kind of creative iteration. And for this example that you see here, we saw that, using these kind of bright reds, we were able to refine our approach and ultimately improve our results with these adding, vibrant veggies and more provocative questions that drove better recall and better web traffic results. So we were really happy with this approach and these results as the project progressed. Next slide, please. And so we learned a few important lessons that hopefully viewers here today can apply to their social marketing or outreach efforts. The first, as I just mentioned, is this kind of iterative process based on performance data. This allows for creative refinement over the course of your programmatic year. You don't have to wait until the next year to make a change. You can be responsive as you go. The second really important thing is the need for continued evaluation so that we can build on this kind of baseline of data that we have from the panel survey and Facebook and repeat our inquiry year over year.
Yeah, and I think one way to go forward with that is to look into having a little bit more of an appropriate timeline before or between when the ads are delivered and when the survey is disseminated, just because this time it was a quicker turnaround for that. And third, aligning our sample, we would like to better align our sample along geographic boundaries, since SNAP Ed areas are designated at the census tract level, and our Alchemer survey was targeting respondents at the county level. And fourth and finally, we will consider ways to improve our survey design and streamline our analysis by revisiting the SNAP Ed evaluation framework and looking how we can improve measuring things like physical activity.
Yeah, and so over the programmatic year, we delivered over 500,000 impressions, and we had a conversion rate at around 3%, which we intend to improve upon this year. And those are results that we're pretty happy with for this, this first year working together. We're tight on time, but please feel free to email us with any comments, questions, suggestions. We'd love to continue the conversation and see how we can collaborate. Thank you all so much and have a great rest of your day.
Thanks, everyone.